Also known as TED, thyroid eye disease is a chronic autoimmune disease. And here to talk about her journey with TED is Wanda Durant, mother of NBA superstar Kevin Durant, and she's joined by Dr. Anna Victoria. Dr. Victoria, I want to start with you. What are some of the symptoms and who is likely to develop this condition?
Thank you for having me and good morning. So thyroid eye disease can present in many different ways, and Wanda will tell us all about her journey as well. It can be something as mild as dry, gritty eyes, feeling like there's something in your eyes, painful as pressure behind the eyes, swelling, bulging eyes, or misaligned eyes that can cause double vision. You can also actually potentially lose your vision from thyroid eye disease. So who's at risk are patients that have Graves' disease. They're up to 50% likely to develop thyroid eye disease, which is the most common type of hyperthyroidism. And these are two separate entities. And that's what we're trying to deliver the message this week, is to be aware that Graves' disease and thyroid eye disease are really treated in a different way. Women are also more at risk of developing thyroid eye disease, 5 times more likely than men. And if you're a smoker, you're definitely more at risk for a more severe type of disease.
Got it. Okay, what types of doctors treat TED and how is it diagnosed?
Sure. So thyroid eye disease is a very specialized kind of condition and is best treated by a thyroid eye disease specialist, such as a neuro-ophthalmologist or an oculofacial plastic surgeon like myself. And there are many ways to treat thyroid eye disease, and that's why it's so important to seek someone who really knows how to treat it. It can be something as simple as lubricating the eye surface or infusing medications, or as severe as having to perform surgery. And that's what we're trying to do, prevent more invasive things to happen to your eye that may need surgery by treating it earlier.
All right. And Wanda, can you share your experience with Graves' disease and the symptoms of TED?
Yes, I've had Graves' disease now for 17 years, and it took 3 years before I was diagnosed. And during that time, I had experienced eye pain, swelling, bulging eyes. And at the time, I was told that it was just a part of Graves' disease. Until recently, I found out that up to 50% of the people with Graves' disease may develop thyroid eye disease. And thyroid eye disease, as Dr. Victoria said, is a separate but related condition that needs to be treated by a specialist. And that's been my experience with Graves' disease and the symptoms of thyroid eye disease.
So what advice would you have for others who are dealing with this condition?
My advice for others is to be the MVP of your eye health, to know the symptoms, journal the symptoms, get educated about thyroid eye disease, and let your doctors know what's going on, and seek a second opinion if you're not getting the answers that you need, and so that you can not have to deal with it like I have for so long without knowing the proper diagnosis.
Well, we appreciate you both spreading the word so that our viewers can be aware of what to look out for. Where can they learn more?
Viewers can learn more on Focus on TED.com, where they can learn more about thyroid eye disease and even find a specialist near them.
All right. I want to thank you both for being with us. We really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.